morning, Tatiana. Come on through.
Thanks.
Nice to meet you.
You
Welcome
too.
to our practice. I see you've got that medical history. I'll just grab
Yes.
that off you. Thank you. Come have a seat.
Great, thanks.
Alright, so Tatiana, you've been experiencing some toothache. How long has that been going on for, and where do you think it's coming from?
I think the pain is coming from my lower right wisdom tooth. It's been about 4 weeks and it's just been this dull, constant throbbing ache. Sometimes also the pain seems to go from my lower teeth down through my neck.
Okay, and on a scale of 10, 10 being the worst, most painful, how would you rate the pain?
Probably about 4 to 5, depending on which day you ask me.
Okay, that's no good. Well, tell me, are you on semester break from university?
Yeah, that's right. So I'm in Brisbane for another month and then I have to go back to Melbourne for uni, so I really want to get this toothache sorted before I go back.
Yeah, no, definitely. It'd be great if we can sort this problem out for you. Tell me, have you noticed anything else in that region? Does the pain keep you awake at night?
The gum in that area is pretty sore and sometimes there's a bit of a metallic taste, so I've been a bit afraid to brush that area, but otherwise no, it doesn't keep me awake at night.
Okay. Have you had toothaches like this before?
About 2 years ago I had an ache in that same sort of area, but it wasn't so bad and it went away after a few days, so I didn't think anything of it.
Okay. Well, look, there are a lot of areas in our teeth that we can't really see, therefore we sometimes need x-rays to assess them further. But before we do that, we might just have a quick look in your mouth if that's okay.
Sure.
Awesome. So, looking in your mouth, it looks like you've got a number of fillings. I'm guessing these have been done when you were a teenager. Was that your last time to the dentist?
Yeah, the last time I went to the dentist was probably about 4 years ago.
Okay, and was that in Brisbane?
No, I actually grew up in Adelaide and lived there until I was 17 and then I went to Melbourne for uni.
Oh, okay. Well, I was in Adelaide recently, actually. Quite a little city with great food. And what's that valley, Barossa Valley? Famous for its wine. I really get the impression that Adelaide is a smaller version of Melbourne, really.
Yeah, that's right. That's exactly how I explain it to my friends who haven't been before.
True. Getting back on track, are you able to point to me where you think that pain is coming from? Which
yeah, I'm
tooth?
pretty sure it's the one right at the back here.
Okay. Let's have a look. So it looks like you've got a partially erupted lower right wisdom tooth, and the gums in that area appear a bit red and there's a bit of swelling as well. So I'm just going to feel along your cheeks and your jaw just to see if there's any tenderness. Is that okay?
Yeah, that's fine.
Okay. Just get you to open for me and close and open again and close. Just feeling under your jaw.
Oh.
Right, it seems like you've got a mild, tender lymph node on this side. On a scale of 10, 10 being very painful, how would you rate that tenderness?
Probably about 3 out of 10.
So, do you generally feel unwell, or have you noticed any pain in that area, or have you had a temperature recently?
No, I feel fine otherwise. I haven't been sick recently. So, should I have my wisdom teeth taken out?
Alright, well, considering the symptoms, it would appear that you've got subacute pericoronitis of the wisdom tooth, and what that means in layman terms is that there's a little bit of gum that's sitting over the wisdom tooth, which has gotten a bit inflamed, and that can often happen when food gets trapped under the gums, which makes it a little hard for you to clean in that region.
Okay.
From the history that you've told me, it would seem like you've had at least one other occurrence in the past. So, with regards to extraction, it would resolve your problem, but we'll probably need to take some x-rays before I can comment further. So I'll send you to get a large x-ray and we'll have a look at it after.
So is this x-ray different to the pair of little x-rays taken inside your mouth? Because I've had that before.
So this is a big x-ray and the machine just goes around your head. And it takes about 14 seconds, but it allows us to have a look at all your teeth in one picture.
Okay.
So Tatiana, here on the screen is the OPG x-ray that we just took. So as you can see, your lower right wisdom tooth here, it is tilted forward into the tooth in front. And interestingly enough, you've got a very horizontally lying left wisdom tooth.
Yeah.
But I think that's not troubling you at the moment, is it?
No.
Okay, so that's good. And just on the back here, you can see some of the fillings that you've had from the past. If you just notice over here by the roots of the wisdom tooth, you can see these white lines
Yeah, I can see that. What are those white lines?
Those white lines indicate the border of a canal that has a very important nerve that runs through it.
Mm-hmm.
And as you can see, although this is a 2D representation of what's in our mouth, those roots of the wisdom teeth sit relatively close to that nerve that runs in that canal.
Oh, and what happens if the nerve is damaged?
If that nerve is damaged, you can get temporary numbness to the tooth or even the soft tissues in that region.
Mm-hmm.
And sometimes there's a very slight chance there could even be permanent numbness.
Wow, really? Does that mean that I can't get my wisdom teeth extracted?
No, that's not the case at all. You can definitely have your wisdom teeth extracted. However, there's just an increased risk of damage to the nerve due to the close relationship of the roots to the nerve.
Mm-hmm.
The left one doesn't seem to be troubling you, so I think we can leave that one for now and just deal with removing the right wisdom tooth.
Yeah, I'd be happy to leave the left one, but I definitely want to get the right wisdom tooth taken out. I just want the tooth gone. I'm back at uni next semester and I really don't want it to flare up. I can't afford to take the time off.
Okay, yep, so regarding your right wisdom tooth, because of how close the roots sit to the nerve, I really think it would be best for us to refer you to a specialist maxillofacial surgeon as they deal with these type of cases. So I'd like to put a referral through, and in the meantime just maybe clean out the gums just to remove any plaque or food that's trapped in there.
Do I have to go see the specialist? Your website said that you perform extractions and that's why I chose this practice. I really can't afford to go see a specialist at the moment.
Well, it would be a lot more preferable if you saw a maxfac surgeon for this, because it could be a little difficult.
Please, can you not just give it a go? I really just want to get it sorted, and like I said, I can't afford the extra expense and the delay of waiting to go see a specialist.
Okay, I will take your case on board then. However, I will need you to get some additional x-rays done. It's a 3D x-ray scan, and I'll need that just so I can see exactly where the roots sit in relation to the nerve. So I'll give you a referral, and if you could get that done at an external radiology practice, and I will receive the report once they've got it done. In the meantime, we'll clean your gums as I said before.
Okay.
So Tatiana, we've just irrigated the gums. As far as pain is concerned, I think we should be able to manage that with over-the-counter painkillers, so I shouldn't need to prescribe you with anything stronger. However, I do need you to try and keep that area clean, so try and do some saltwater mouth rinses every day, and once the inflammation settles a little bit, if you can try and brush in that molar area just to keep it clean. Prior to the extraction, if you do notice any swelling or pain, just feel free to give us a call. Alright, I'll leave you with a receptionist to book the next appointment. Hi Tatiana, how's it going?
Hi, not bad, but I'll be much happier when this tooth's finally out.
Okay, and how have you been feeling over the last few days? Has the pain worsened?
I've been doing the regular saltwater rinses, like you said, and I've been brushing my teeth like normal. It's definitely settled down a lot.
Okay, well that's good. Now look, so I've had a look at the 3D scan that we ordered, and I've also had a read of the report that came back. Now, as I suspected, the roots of the wisdom tooth definitely sit very close to the canal that runs down the jaw. And I'm not sure if you remember, but I mentioned to you how there's a very important nerve that runs down in that canal, and there's definitely a risk of damage to that nerve. Now, there are other risks and complications involved with extractions as well that I will be going through with you. If you have any questions, now is the time to ask. I'll go through the consent form with you, which also covers things that we've discussed.
Okay, sure.
Okay. Alright, Tatiana, it's been 3 days since the extraction of your lower right wisdom tooth, and our receptionist Ruby has booked you in for an early review as you were concerned about healing in the region. What is concerning you?
It actually has nothing to do with the pain. The pain's been quite manageable at the moment. What I'm really worried about is that I'm still experiencing numbness on my teeth and lip on my lower right side. Is that normal?
No, it's actually not normal. The local anesthetic that we gave you for the extraction should have worn off by that evening. Numbness on day 3 potentially suggests that there has been damage to the main nerve that runs down in the jaw that we spoke about previously.
So the nerve in my jaw has been damaged. Am I going to have permanent numbness?
The extraction side is still healing. There is still some localized swelling in the region. It's a little hard to say how long the numbness is going to last for. However, it's still early stages. It might take a while before the feeling returns to normal, but I do think it might be a very good idea for us to refer you to the maxillofacial specialist just to have that extraction area assessed and then go from there.
Okay.